Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter H. I'm going to talk about another disease today, which is hypothyroidism. Previous video I talked about the hypothyroidism, so today I'm going to talk about the hypothyroidism, which is much more common compared to the hyperthyroidism. So basically, is there any emergency situation associated with this hypothyroidism? Usually not, because usually this is a chronic condition, unless there's a acute, massive destruction of the thyroid. Usually that it has the hypothyroidism, severely cold and low blood pressure, low metabolic rate. So that if that's the case, usually is accompanied by the radiation therapy or acute damage. But usually, general speaking, hypothyroidism is not quite commonly associated with the emergency situation. So I have talked about the thyroid, which is in the anterior cervical area, center, and in front of the trachea. And the hypothyroidism, what are in terms of epidemiology, who tends to have this kind of hypothyroidism? Young or middle-aged female or male, without a cause, probably after the viral infection, or just some of the female after giving birth, and the pituitary and also the thyroid undergoing the change and causing this or subtle ischemic. It's not quite common, but it's possible. Sheehan syndrome, for example. If that's the case, then not just the hypothyroidism, the whole endocrine system was kind of at a low function level, decreased, because the pituitary gland is undergoing the ischemic, usually occurred after the woman gave birth, called the Sheehan syndrome. So usually this kind of, nowadays I think hypothyroidism is caused by the viral infection or autoimmune cause or idiopathic, without, which means cannot find any cause of it. Can you manage at home? Depends. Usually need to be treated under supervision from the physicians to replace the hormone, thyroid hormone tablet. So you cannot manage at home. So anyway, what kind of symptoms of this hypothyroidism? Very subtle, in terms of generalized, feel tired, fatigue, I feel low, feel lack of energy, afraid of cold, dry hair, dry skin, and gaining weight, because the metabolism is slowing down, a lack of this hormone. So that's in general the symptoms. And also mood is also affected, tend to be mimic depression, but it's not exactly as depression, but just feel like lack of energy. So that's the symptoms. And especially for young female, in terms of diagnosis, there's a very straightforward test. I think nowadays is in the screening test, TSH, thyroid stimulating hormone. So this is talk about this. It's a number. The lower limit is 0.4 to 0.5, and the higher limit is 4 to 5. So, for example, if the TSH is high, that means your is higher than 5, which means that you do not have enough thyroid hormone to inhibit. So that's the diagnosis of hypothyroidism. On the other hand, hypothyroidism is just the TSH is low because the thyroid hormone negative feedback to inhibit the TSH. So this is just give you introduction of how to interpret the test. On the other hand, just the numbers. For example, your TSH is not a 5, it's not a 4, it's a 5.5. So what do you think? And you feel the symptomatic, you feel gaining weight, lack of energy, feel afraid of cold, and hair is dry, you meet all the criteria for clinical diagnosis. However, the lab shows your TSH is not in that 0.5 to 5 or 0.4 to 4. So this is the kind of situation really depends on your physician. If I were in that situation, if my patient like that, I probably recommend to replace hormone to treat it, because this is 10 times of range, 0.4 to 4, 0.5 to 5. So if you replace low dose of thyroid, will not inhibit the TSH, will not impair the whole axis of endocrine. But this is so really depends on your physician and on how severe your symptoms are. So, but this is worth to discuss with your physician if you have the symptoms. Even though your lab came back TSH is normal, you're middle-aged man, female or male, you feel lack of energy, feel afraid of cold, dry hair, dry skin, gaining weight, feel sluggish every day, feel cold all the time. Talk to your physician, see whether there's any possibility that you can be managed with this low dose of the thyroid hormone to correct this borderline or normal hormone level, but your function is not that optimal compared to your usual condition. So if that's the case, really worth to talk to your physician. So anyway, this is about hypothyroidism. It's quite common and easily to be missed, especially for young female or some and it's easily to confuse with a psychological disease like depression or anxiety disorder, because especially depression, I feel lack of energy. So this is about the hypothyroidism. I hope it helps. If you have those symptoms, talk to your physician, see whether there is some way to manage to raise up your metabolic level, to raise your function level. I'm going to stop here. Thank you for watching. I'll see you next time.